Hello and Namaste. I am Dr. Alisha Manandhar, lecturer in the Department of Community Medicine. I welcome you all to yet another session of Recall CEE 2077. Before I start with the questions, I would like to request you all to please follow standard textbooks of community medicine for your reference. Let's start with the questions now. Our first question is, chi-square value is 2.7 and degree of freedom is 1. So what is the p-value? In this question, we are asked to find out the p-value when chi-square value and degree of freedom is given. So in these kind of questions, we have to look into the table, and our options given are 0.1, option B 0.01, more than 0.05 and less than 0.05. So let's look into our table. So this is the chi-square distribution table. Here we have degree of freedom, 1 is given in the question, and chi-square value is 2.7. So in this question, our p-value is 0.10. So the answer is 0.10. So in this question, our answer is 0.1, which we have found out from the table. In these kind of questions, another question, probable question that may arise is, you may be asked to find out the degree of freedom. Now to find out the degree of freedom, we should be knowing about the formula, how to find out the degree of freedom. The degree of freedom formula is given by R minus 1 times C minus 1, that is row minus 1 times column minus 1. Okay, so let's move into the another question. So our next question is, what is the method of finding a known case in an apparently healthy individual? Our option given are screening, monitoring, surveillance, and case finding tools. So let's look into our explanations. So what does screening mean? It means the search for unrecognized disease or defect by means of rapidly applied tests, examinations, or other procedures in apparently healthy individuals, that is, in those populations or individuals who are not seeking health care. So in these kind of questions, we should be able to grasp the keywords, like in this question, apparently healthy individuals is the keyword. So let's look into our question. So here also apparently healthy individual, this word is given. So if we can catch hold of these keywords, we can easily identify our correct option. So in this question, our correct option is screening. So let's look into other options also. So what does monitoring and surveillance mean? Monitoring means performance and analysis of routine measurements to detect changes in the environment or health status of population, whereas surveillance means continuous scrutiny of factors that determine the occurrence and distribution of disease and other conditions of ill health. So we may be asked about the definition of surveillance also. So in surveillance, this is the keyword that we should be able to identify, that is continuous scrutiny of the factors. So if we can identify our keywords, then we can easily choose the correct option. So coming to monitoring again, it is one-time linear activity, whereas surveillance is a continuous cycle. In monitoring, it is no feedback is present, whereas in surveillance, feedback is present. In monitoring, there is no inbuilt action component present, whereas in surveillance, inbuilt action component is present. Monitoring stops once the disease is eliminated or eradicated, whereas surveillance, it continues even after the disease is eliminated or eradicated. Monitoring is a smaller concept, whereas surveillance is a broader concept. So if we have idea about all these points, then we can easily answer questions on monitoring or surveillance. So now let's move into our next question, that is, what is the recommended minimum number of ANC antenatal care visits according to WHO's 2016 ANC model? Option given are 2, 4, 8 and 12. We should be very careful while reading the questions, because we are asked about the minimum number of antenatal care visits according to WHO's 2016 ANC model. So this is the updated one given by WHO. Let's look into the explanations. So according to WHO's 2016 ANC model, perinatal deaths increase with only 4 ANC visits, and that an increase in the number of ANC contacts, regardless of the country, is associated with an increase in maternal satisfaction. Previously, it used to be only 4 ANC visits. So, researchers and studies have shown that only 4 ANC visits can increase the perinatal deaths, whereas WHO has come up with a new recommendation, that is here. WHO recommends a minimum of 8 contacts. Previously, it was only 4, but in the question we have been asked about the updated one, 2016 ANC model. It has recommended 8 contacts, that is 1 in the first trimester, 2 contacts in the second trimester, and 5 contacts in the third trimester, making it a total of 8 contacts. So when do we do these 8 contacts? That is, in the first trimester we do first contact up to 12 weeks, we should be having 1 ANC visit. In the second trimester, 2 contacts, that is at 20 and 26 weeks. And in the third trimester, contact 4 at 30 weeks, contact 5 at 34 weeks, contact 6 at 36 weeks, 7 at 38, and 8 at 40 weeks. So this makes a total of 8 contacts. So let's look into the correct option now. We know the correct option. So the correct option here is option C, that is 8 contacts. Now let's move into our next question, that is, according to the National Immunization Schedule of Nepal, the vaccine to be given to a child at the age of 9 months are. So in this question we are asked to find out the vaccines which should be given to the child at the age of 9 months. So to answer these kind of questions, if we know very well about the National Immunization Schedule of Nepal, that is not going to be a big problem for us. So we should be very well versed with the National Immunization Schedule of Nepal. And in this chart, I have shown every detail that is needed to answer questions related to the National Immunization Schedule. That is the vaccine, disease, age, frequency, routine, injection site, and doses. Everything I have shown in this chart. So I will not be going into each and every vaccine. You can pause the video and see for your reference. And in this question, we have been asked the vaccines to be given to a child at the age of 9 months. That is, first one is here, it is 9 months, and next one is here again 9 months. That is PCV and MR, that is pneumococcal conjugate vaccine, as well as measles and rubella. So let's look into our options. So our correct option here is option C, that is measles, rubella, and pneumococcal. So let's look into our next question. In this question, decrease in the incidence of a disease to a level where it ceases to be a public health problem. So in these kind of questions also, we should be able to catch hold of the keywords. That is, here we can take our keywords as to a level where it ceases to be a public health problem. So in these kind of questions, if we can catch hold of the keywords, then it will be easy for us. Let's look into the so the options given are control, elimination, eradication, and surveillance. Let's look into the explanations. Here there are different concepts of control of disease. The first one is disease control. It says reducing the transmission of disease agents to such a low level that it ceases to be a public health problem. So this is the keyword that we were talking about, which we can find in the option disease control. It aims at reducing incidence and duration of the disease, effects of infection, financial burden to the community. So here we have got our answer as control, that is option A. Let's look into other options also. Disease elimination means complete interruption of transmission of disease in a defined geographical area, but the causative organism may be persisting in the environment. So while answering the questions on elimination, we should be well known that the transmission of the disease in a defined geographical area is still, we have to interrupt the transmission of the disease in a defined geographical area, but the causative organism may still be persisting in the environment. And disease elimination is a geographical term. It is a geographical term, that is, it can be used only for a country or a region. So let's look into our other option. It was disease eradication. So it means complete extermination of organism tearing out by roots of a disease. It exhibits all or none phenomenon, and disease eradication is a global term. Elimination was a geographical term, whereas eradication is a global term, that is, it is used only for the whole planet. World has eradicated only one disease till date, that is smallpox, which was declared eradicated on 8th May 1980. And the three next diseases for eradication globally are polio, measles, and guinea worm. Another probable question that may be asked from these kind of questions is, our option D is surveillance. So we may be asked about different types of surveillance, that is active surveillance, passive surveillance, and sentinel surveillance. And one more important question and most frequently asked is about sentinel surveillance, that is, it means sentinel surveillance helps in identifying missing cases and supplementing notified cases. So in sentinel surveillance, the keyword that we should be able to identify is identifying missing cases and supplementing notified cases. So these particular words are, if given in the question, then we should be able to identify that the question is about sentinel surveillance. So let's look into our next question. It is, what will be the contraceptive method of choice for newly married women with uncontrolled diabetes and a history of liver disease and atherosclerosis? So in this option, we are asked to find out or suggest the contraceptive method of choice for newly married women along with comorbidities, that is uncontrolled diabetes and a history of liver disease as well as atherosclerosis. So in these kind of questions, we have to read the questions very carefully. So in this question, the case given is newly married woman. So if it was only newly married woman, we could choose oral contraceptive pills. But we have comorbidities also given in the question, that is uncontrolled diabetes and a history of liver disease and atherosclerosis. So in these kind of questions, we cannot use oral contraceptive pills. We cannot use progesterone only pills. These are hormonal pills. IUCD also we do not refer, whereas the only safest option would be barrier method. So moving to next question. Which of the following is used to plot the patient's systolic blood pressure over a period of time? So we are asked to find out the choose from the options given to plot the patient's systolic blood pressure over a period of time. So here, looking into the explanations, histogram is a graphical presentation for continuous quantitative data, that is for continuous as well as quantitative data. It is used to visualize the shape or distribution of data for a single quantitative variable such as systolic blood pressure, age, or birth weight. Continuous groups are marked on the x-axis while frequencies are marked on the y-axis. And in our question, we are given the question about blood pressure. So blood pressure is a quantitative as well as continuous variable, and because it is a continuous variable, sphygmomanometer can only measure with a minimum count of 2 mm mercury, but it has several in between values. It is a polyotomous variable, that is, it can have several values possible in between 2 mm of mercury. It can have several values possible. It is a quantitative continuous variable. So looking into our option, the best option would be histogram, as it is a continuous quantitative variable. The blood pressure is a continuous quantitative variable. So our correct option is histogram. Line diagram cannot be the correct option, as line diagram is basically used to plot the changes over a period of time. Bar diagram we cannot use, pictogram also we cannot use. The only correct option is histogram. So now looking into our next question, the most effective way to control COVID-19 disease globally is, so isolation and quarantine of cases, we can use this. Vaccination, it is not possible to vaccinate all the individuals globally at the same time, so it is not feasible. Early case detection, it is also feasible to some extent, but we cannot guarantee that we'll be able to detect all the cases early. Management of cases is a secondary option after all the options given above. So the only possible or correct option is isolation and quarantine of cases. So many questions can still be asked from the isolation and quarantine part. So I've given the differences here. So isolation is done for separation of cases, that is those with the diseases, whereas quarantine is done for healthy contacts of cases. Isolation is done for cases themselves, whereas quarantine is done for other persons around. And level of prevention for isolation is secondary level of prevention, because in secondary level of prevention, the mode of intervention is early diagnosis and treatment. And isolation falls under secondary treatment, because secondary level of prevention, because we are basically like treating the patients in keeping them in isolation, whereas quarantine falls under primary level of prevention, that is we are giving specific protection to the people who might have acquired the disease. So the duration of isolation is till recovery, that is period of communicability, whereas quarantine is till maximum incubation period. For example, another question that may be asked from this question is, what is the maximum incubation period of yellow fever? So in yellow fever, the maximum incubation period is 6 days. So we quarantine the people in yellow fever for 6 days. Now moving on to our next question. The parameters of sensitivity and specificity are used for assessing. Options given are criterion validity, construct validity, discriminant validity, and content validity. So let's look into our explanations. The parameters of sensitivity and specificity are used for assessing criterion validity. And what does validity mean? So validity refers to what extent the test measures what it purports to measure, that is adequacy of measurement. So from this much of explanation itself, we have found out our answer, that is the answer here is criterion validity. So another probable question that may arise is, validity has two components, that is sensitivity and specificity. So another MCQs that you might be asked is, what are the components of validity? So you may be given different options, and from that you have to choose sensitivity and specificity. So this may be another MCQ question. Now the types of validity, there are different types of validity: conclusion validity, internal validity, construct validity, external validity, concurrent validity, phase or logical validity, discriminant validity. I will not be going into each and every types of validity. If you want, you can pause the video and see for your reference. Content validity, consensual validity, criterion validity. Since our answer is criterion validity in the question given, it is if compared with the reference or gold standards, it is known as criterion validity, and it is the best measure of validity, usually expressed as sensitivity and specificity. So another probable question that may be asked from this particular question is, you may be asked to find out the sensitivity and specificity in MCQs like. So to find out the sensitivity and specificity in any particular question, different values will be given for you to calculate sensitivity and specificity. But before that, you should be knowing the formula to calculate sensitivity and specificity. So before telling you the formula how to calculate sensitivity and specificity, I would like to tell you about the how to construct the table to find out to put into the values to find sensitivity and specificity. Suppose we have exposure and disease. So we can construct table like this. Again, here we have, that is disease exposure present and exposure absent, disease present and disease absent. So it is true positive, it is false positive, this is false negative, this is true negative. Our sensitivity is given by formula true positive by true positive plus false negative, whereas specificity is given by formula true negative by true negative plus false positive. So now if you can easily find construct the table and know which ones are true positive, which ones are false positive, which ones are true false negative and true negative, we can easily put into the values and find our correct answer. Okay, so now I would like to tell you about one probable question that may be asked is, another probable question that may be asked is, we may be asked to find out positive predictive value and negative predictive value. So to find out positive predictive value from the same table, we can find out, that is, in positive predictive value, what we do is, formula is true positive by true positive plus false positive. In our denominator, all positives we will take, and in negative predictive value, true negative by all negatives in our denominator, that is false negative. So now we can easily calculate questions on sensitivity, specificity, positive predictive value as well as negative predictive value. Let's move into our next question now. Our next question says, what is the intelligence quotient, that is IQ, for mild mental retardation? So we are given option A less than 20, B 21 to 34, C 35 to 49 and D 50 to 69. So first of all, we should be knowing how to classify IQ levels according to mental retardation, level of intelligence, and what basically is IQ. So let's look into our explanation first. So intelligence quotient, that is IQ, is score derived from one of several different standardized tests attempting to measure intelligence. So it is basically to measure intelligence. First intelligence test was developed by Binet and Simon. Stern's IQ test is, this is basically, originally IQ was calculated for children. So how do we calculate IQ? It is given by formula, that the formula given here is, IQ is given by mental age by chronological age times 100. Suppose our mental age is 10 and our chronological age is 5. So our IQ will be 5 to the 10, that is 200. So this is the just example that I am giving you. So Wechsler's Adult Intelligence Scale, WAIS, David Wechsler published the first intelligence test designed for an adult population, and it was the first IQ test based on normal or Gaussian distribution. So the classification of IQ that we need to know is levels of intelligence based on IQ level. So levels of intelligence are, there are different levels of intelligence, that is, for idiot, the IQ range is 0 to 24, for imbecile 25 to 49, for moron 50 to 69, borderline 70 to 79, low normal 80 to 89, normal 90 to 109, superior 110 to 119, very superior 120 to 139, and near genius is 140 and above. So many of us, we get panic by looking into the table, because there are so many so many levels of intelligence given that we may be confused. So for which one, which IQ range is to be taken? So I have one simplified formula. So the formula is, I identify myself as brave, low normal, that is, I identify myself as brave, low normal, superior, very superior, near genius. Like for I, we have idiot, another I, imbecile, for M, moron, for B, borderline, for L, low normal is given, and rest same as it is given. That is, the formula is, I identify myself as brave, low normal, superior, very superior, and near genius. So if we know this formula, then we just have to keep in mind the IQ range, that is from 0 to 24, likewise 25 to 49, 50 to 69, 70 to 79, and so on. So another way of classifying IQ level is according to categories of mental retardation, and this is what is asked in our question. We have mental status as normal, mild mental retardation, moderate, severe, and profound mental retardation. So the normal level starts from 70 and above, mild mental retardation 50 to 69. This is what is asked in our question. Moderate mental retardation 35 to 49, and severe mental retardation 21 to 34, and profound as 20 and below. So in our answer, so in our question, the correct option is asked about mild mental retardation, that is option D, 50 to 69. We can see here mild mental retardation is 50 to 69. Thank you everyone, and I wish you all the luck for your exams.